Thank you so much for this great opportunity to present this project entitled Breaking the Silence, Group Discussions, Social Pressure, and the Adoption of Health Technologies. This is joint work between Silvia Castro, a PhD student at the LMU Munich, and myself, Clarissa Mang, also a PhD student at the LMU Munich. We start this project from the observation that social pressure and stigma can deter individuals from adopting advanced health technologies and treatments. So for example, if we think about HIV treatments or mental health treatments, oftentimes people do not want to admit that they are suffering from these conditions because they are worried about being stigmatized, and so they do not adopt the latest available technologies to help them with diagnosing and treating these conditions. We want to explore the effect of social pressure and stigma on technology adoption, in particular in the setting of menstrual health management in Bangladesh, and test a potential solution for this constraint that social pressure and stigma pose for technology adoption. Why do we focus on menstrual health management? So first of all, menstruation is something that affects almost half the world's population at some point or other in their life. And we know from previous literature that inadequate menstrual health management can negatively affect health, education, attainment, and labor market outcomes. So it's something that can have severe consequences for a large number of people. Moreover, with menstrual health management, we have a situation where the women that we want to interview are not worried or shy about admitting that they do menstruate, as would, for example, be the case with HIV or mental health issues, where participants are much less willing to participate in surveys about it. And so we can have a relatively large sample size without worrying too much about self-selected samples. And lastly, an interesting puzzle in the context of menstrual health management is that solutions such as sanitary pads are usually widely available and well known, and yet they are not widely adopted. So in this project, we want to ask the research question whether a simple light touch intervention of conducting open group discussions about menstruation can reduce the social pressure and stigma, and thus increase take-up of modern hygienic menstrual products, namely sanitary pads and reusable menstrual underwear. We look at this question by conducting a field experiment with 476 female workers in a Bangladeshi garment factory. And around half of those women are subject to our treatment, which consists of a 1-hour guided discussion session, where the women in groups of 15 to 20 people get to openly discuss menstruation and the experiences that they made with it. So we do not give them any extra information or we do not educate them, but we just let them discuss among themselves and share their own experiences, anxieties, fears, and so on. Our primary outcomes are, first of all, the willingness to pay for sanitary pads, and second, the pickup rates of antibacterial reusable menstrual underwear, which we make available for them for pickup for free. Now, both of these products have to be picked up on the factory premises in a small convenience store there run by a male shopkeeper. And so our hypothesis is that after the 1-hour discussion session among each other, these women will be bothered less by potentially being observed by colleagues when they pick up the product, and also will worry less about talking to a male shopkeeper because they will feel that the stigma and the social norms around this topic are actually lower than they thought. And to look at the mechanism in more detail, we have also explicit measures for social norms, stigma, and taboos. And what we find is that indeed our treatment was successful in increasing the willingness to pay for sanitary pads by more than 25%. So it goes up from around 91 to around 114 taka. And we increased the pickup rates of the free menstrual underwear by more than 10 percentage points, from around 71 to around 81% of the women picking up this free product. Looking at the mechanisms, we can see that there was a shift in the perceived social norms. So while a majority of women before the treatment viewed purchasing pads from a male shopkeeper as socially inappropriate, this shifts to it being viewed as socially appropriate by the majority after treatment. And moreover, our explicit measures for stigma and taboo, where we gave the women a list of 4 statements expressing stigma and taboo and asked them to how many of those statements they agree, we can see that after the treatment, the women agreed to 50% fewer statements than before the treatment. And lastly, we conducted a discrete choice experiment in which we can pin down the mechanism and show that it is not a change in perceived value for money, but instead that the women really are bothered less by having to talk to a male shopkeeper and by potentially being observed by colleagues when they pick up the menstrual underwear. That was the short 5-minute pitch of our project. If you have any questions, comments, or recommendations, please feel free to email either myself or my co-author about this. And thank you so much again for this great opportunity.